Greetings, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. We bring leaders together to not only inform you, but also unearth bright spots, successes at health plans, hospitals, and other healthcare-related organizations. Our goal is to identify as many bright spots as possible so that you can determine if the ideas shared during this episode can be applied at your organization. We believe this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. Our guest today is Marc Willard. He is the Chief Executive Officer of Icario, and we're going to talk today about the evolution of digital technology and how health plans and ACOs have the opportunity to truly reinvent how they communicate with members and inspire calls to action to participate more proactively in their own care. So, Marc, welcome to Bright Spots, or welcome back, I should say. I think you've been on the show before. Maybe you haven't, but I think you have. We've done a panel together. Maybe that's where I'm getting confused, but welcome.
Thank you. We've done a panel together. Nice to be here. Hopefully my accent is okay for everybody.
I think your accent will breed sophistication and
maybe.
Let's talk about trends in digital health first. And what trends in digital health engagement do you think plans are underestimating potentially? And then how can they better prepare for the future? So let's start right there.
Yeah, no, absolutely. And for me, I would probably say not necessarily underestimating, probably lagging. And one clear one to me is the use of data and AI to kind of personalize the mobile health and digital therapeutics, sort of channels out to our members. I'm a real believer, frankly, placing human health back into the hands of the individual and, empowering those individuals to make good life decisions based on knowing their data indicators and kind of using synthesized insights from others like them. If you think about, disease progression, so like think about sort of type 2 diabetes, the data can really help an individual understand where they are now and based on other people out there where they could likely be. Years ago at Humana, when we embarked on a member patient strategy, we called that concept Know Me, to really get to know your member through the data. I really believe that, we can slow certain disease progression conditions with mental health education through digital therapeutics. I think stress is, a really good example of it driving lifestyle chronic conditions. And it adds, chronic conditions add such a huge amount of cost to our healthcare systems. And, in general, they create such a poor quality of life for the individuals in their outer years. I guess another area that, we shouldn't sort of underestimate, and it probably is lagging, is, the baby boomers are moving into Medicare and, they really demand a digital first strategy, and especially now with Gen X's and Gen Z's coming in. So I would actually kind of go on, Eric, but ultimately I think it's, more of a lagging statement than underestimating, because they understand they need to do it. It's just how do you do it? How do you do it? So
I was going to ask you for an example of a health plan that was doing this really well. And you'd mentioned Humana and the Know Me strategy, and that might have been a little bit back in time, but I want to get a better sense of what enabled them to execute on that strategy and get to know their member better. So I'm wondering if you could shed some light on that, because I think it'll set the stage very nicely for the conversation that's got through.
Yeah, and I think being prepared is super important as well, and plans sort of not really understanding the power of data and insights and really taking it seriously. How to bring it into the organization, how do you organize it, how do you transform it, how do you store it? Also, it's super useful to kind of get into those lifestyle workflows, and clinical workflows become like super important. And and today I would say that a lot of plans do things in silos, which is a real challenge. So they make it work for themselves in one department, not for the whole enterprise, or quite often they just make it work for their enterprise and not other enterprises around them. Your point is anyone like killing it? Honestly, I'll just tell you, I don't think we're killing it at all right now. I think it's an evolution that's gonna continue for a number of years. However, there was one great experiment in with the power of digital, and that was during COVID, where literally plans and providers had to rally incredibly quickly to a full digital health strategy, from everything from telemedicine all the way through to prescribing drugs, picking up drugs at the doorstep, through to using digital therapeutics to try and cope with mental health issues. It was a really really a good experiment. The reason I call it experiment is because it feels like we've sort of taken the break off now and slowed down a little bit and gone back to the old ways of working. At Humana, I had a really good cool frontline seat during COVID, and was really able to push digital ideas and sort of born inside the company and with our partners to the front line very quickly. But now I see it's kind of like wound back a little bit. So I'm curious to that. I think to myself, why is that? And I wonder whether the CMS needs to rethink, especially on government sponsored programs, their digital strategies. I feel like CMS is slow to adopt things, and we've got some interesting examples like Icario where it would make a huge amount of sense to go digital first, but we can't because of probably a regulation that's 30 years old. Yet, Amazon operating outside of the CMS can do it in any way they want. So I don't think anyone's killing it yet. I think everyone recognizes it. I think plans and providers are trying to become prepared for it, but I think they need a lot of help from outside innovators. Hopefully that
So
answers
yeah,
the question too.
so I just want to. You said a few things, especially when you were talking about the know me strategy. You said you need to be prepared uh, via the data and the insight that data brings you. You need to understand how to best bring that data and information into your organization, and how to store it. And so I think it would be interesting later on to come back to sort of how health plans can do that, because my guess is, or do that better in some cases. And so when with that as background, like the insights and experience you gained from all of that, how has that informed you in thinking about healthcare and the strategy of personalization and engagement? So let's take Humana for instance. How did your experience there, particularly with Transcend Insights, shape your vision for the direction you're taking with Icario today?
Well, I learned an awful lot. So really, it all started with Certify. Certify was a provider in a lot place. So can we connect to small primary care offices with large hospital systems with specialists? So I just learned an awful lot around the importance of sharing clinical data as near real time as possible for the member or for the patient. Transcend Insights was an evolution of that. And in fact, as Humana was acquiring my company, I met Bruce Broussard at JP Morgan back in 2012. And as we were consummating the deal, he said, I heard you have a thesis. I said, I do. I don't know what it's called yet, but I want to analyze all the data I have and try and deliver these moments of influence to doctors to get Eric to do something. It's called population health now. And Bruce said, you know what, Mark? We're going to fund you to carry on your entrepreneurial journey and start a company inside Humana. You can sell the technology outside, but it's also going to be beneficial to us. And that's Transcend Insights. So it's a population health company. And the learnings of that, amazing. I mean, suddenly I had, millions and millions and millions of members with thousands of data points on them, all available for me to ingest. Back then it was rules-based analytics. We were trying to get to predictive analytics, really early signs of machine learning, all to try and deliver this one nugget of information into that equity EMR right in front of your doctor, Eric, right when you're sitting in front of him. And so, man, it was challenging. It's super easy to say. And in fact, another company I was at, Noosh, which was in the late 90s, early 2000s, we built a broker system for the property and casualty market, Lloyd's of London, and using XML. And it was way easier to do that in the 90s than to do this in 2010 because of just how healthcare works. I understand the regulations. I totally get it, but it wasn't regulations that stopped me. It was politics. You can't put that information in my EMR without paying me this toll. and I could go on about interop. But anyway, I sort of moved down a pathway, but a huge amount of learnings with certified TI helped me where I am today.
Could you share a specific success story of a health plan that is just just creating a different experience for their members and how they communicate with their members, whether it be HRA, whether it be another HEDIS lever, or anything in between? Can you just share an example of how a health plan is doing it?
With my previous experiences or where I
Yeah,
am
why
now
don't we bring it
or everything.
current day to sort of some of the
Yeah.
current capabilities that you've brought to light now?
Yeah. Well, I mean, Icario, as I joined it, we wanted to rethink our operations, bring in this new data platform, which I would love to kind of show and go through with you. And we had one very large plan that was part of this on DSNet. I would have given us a B minus if I'd have graded back in January 2023. Now I'll give us an A plus plus. We deployed our data platform. We highly organized the data. We really understood how the member was being engaged. The plan completely partnered with us to make sure that the data quality was good, the outreach was in timely fashion, and we took that up a whole star level, which doesn't sound a lot, but when you're pushing out surveys to members, to move the needle on a star to 3 to 4 was absolutely incredible. And it was just and that was 2 years ago. We did incredibly well last year with them as well. And it's a really good example of how the plan just leaned into us, leaned into our knowledge and expertise, leaned into the technology to try and move the needle with a member. And this is not even our latest announcements that's coming out, which I'll share with this.
Right. Before we go there, let me just summarize what I just heard before we go there. DSNP client, uh, we we helped enhance or bring a new data platform to allow them to better understand how to interact and engage with a member. Can you get can you get more specific? Like I want like our listeners to hear like let's say a specific example of what this when you kind of evolve from B minus to A plus plus, what what exact like some case examples within this client example, where we could really tangibilize what some of the technology and expertise you were providing this DSNP plan so that people could picture it.
Yeah, and it's and all of our clients get this expertise. So if you think about it, just even forget about healthcare. If you think about how to engage an individual, the most important thing to do is to understand the type of individual that you're engaging, understand the environment that they live in, and use data that you have from the past that might put that individual into a specific cohort that gives you a sense of how they want to receive you. So we, what we can do is we can understand based on that individual's zip code, Eric, some of the social determinant of health elements that tell me whether they've got, frankly, a smartphone or they desire to use more traditional channels, like telephonic or mail. And we build an outreach algorithm that will basically bucket the members to outreach them in the way that we think they're going to respond. Because if you take DSNP, the one thing you have to be very careful of, in fact, with all engagement, is member abrasion. There is a point where the return falls off by the number of outreaches you do. If you can do it in 1 or 3, there's no abrasion. If you're outreaching 8, 10 times to make it happen, you'll create a lot of abrasion, they won't respond. So we hone the way we do it, and then we have a feedback loop. And if we can't get Eric, we think, Eric's like Mark, he should definitely take telephonic. No, Eric is not responding. So we push out a drip campaign via SMS. If you allowed us to use SMS to let you know, we're going to send you a link, and you're like, I like email. Well, the next time we see another Eric, we'll push email straight forward first, because we realize that Eric liked email. He didn't like, unlike Mark, he didn't want to be telephonic, right? So we just have this continuous loop of learning constantly. and you hone the messaging to the point where you understand how to communicate with them, the types of questions that make sense, how you order them, certainly the language, the type of channel that you outreach, and the moment that they're going to respond. Maybe over the last 3 years, Eric, people like you never respond on Monday at 10, but always respond at Tuesday at 5. So you build that into your algorithm as well. So that's why the data is so important to understand how to organize it and how to bucket it, and then how to derive the insights on it to tune the machine that outreaches. And it starts with the plan giving you high quality data. We need accurate addresses, phone numbers, contact information, demographics, as much as they can give us to tell me about Eric would be super important.
So,
Make
so
sense?
uh, you said something that caught my attention there. So, I understand the zip code. I think I understand a lot about how we want to better know how Eric wants to be communicated with. But how are you incorporating things like the time of day or the day of the week and the time of that day where I may be most willing to pick up the phone or respond to a text? How are you accumulating that knowledge on an ongoing basis and then incorporating it into the campaign?
Yeah, I'll throw out a membership count number, and someone at Icario will probably connect me somewhere, but cannot correct me. But if you think we probably have outreach to anywhere between 70 and 100 million members in our journey over the last number of years, we keep all that data. You're not unique, Eric. We would have reached out to somebody like you and picked up a lot of information about how you completed, when you completed, what made you complete, right? Meaning finish the survey. That information is all fed back. So when we build our sequencing back out, we take all the previous data, move it together, and then create this sequencing channel. I can have and it's all automated. So there's a rules engine, right? That's all fed. And machine learning is making a big play into this now, which we can talk right at the very end. But there's a rules engine in there, and it can call you at 3 p.m. on a Wednesday, and it knows when to call you. And if you don't respond, it will give it an X amount of time and reach out again. Or it can change the channel and say, Eric's not called, and pick up the phone. Why don't we email him, right? Or why don't we send him a QR code? What I really would love us to be able to do is embed all the HRAs in these, right? So I can nudge you as well, just like Amazon. You put something in your basket, and Amazon will nudge you and say, hey, there's 14 other people trying to buy this thing, and there's only like 15 left. You're going to hit checkout. That's a nudge. So all that's being built into platforms today, including us, and it's getting very sophisticated.
Okay, so there's a bunch of machine learning and AI tied to the platform and the capability that allows you to almost learn as you go and then incorporate that. What about the
Well, right now, because I just want to make sure the audience understands. Right now, with our current technology, we're using a rules-based engine to do that. So that's kind of like static, right? But it's still very, very sophisticated. What's real. The new platform, which is live right now, coming out, uses a lot of machine learning to be way more dynamic. So with
okay.
real time feedback loops, Eric. So you have not responded. It comes back to the system. A machine learning model will automatically look at people like you and then try and adjust the sequence in real time. So it's not a program.
I want to get into that because that's really interesting to me. Before we do, how do you think about incorporating into the health plan team's workflow? Because it sounds like it's a little bit potentially disruptive, and so implementation and ongoing operations could be a burden. How do you work through that?
Well, I've learned over the last, oh my word, I think it is 20 years in healthcare now, that you need to partner with your customer and not replace, right? And obviously, I spent a lot of time with Humana. I spent some time with Centene. You need to be able to integrate using open standards into their platforms, and that's how we do it. And we offer our customers choices. If honestly, they still have flat files, so they're comma delimited type flat files. But we will offer them the basic integration, which we don't really want to do because we want to have a bidirectional feed. data quality, remember, as things update in the plan, we want it immediately. So we'll offer them an API, a very open standard API, we'll embed that way. And we always give back insights to them. It's not about completing, that health assessment. It's about the information you glean from that health assessment that can impact their care later on. And if you look at today, you read some of the advanced notice by CMS around that decent HRA, they're actually moving the needle from the plan gets rewarded for completing it to what are you doing with it? And that's music to my ears, because there has to be a feedback loop here, right? Where Marc Willard completes his HRA and sees some personalized care plan because he did that. And that's where digital gets us all the way back to the beginning, right? That's why he says, anyone knocking it out of the park? Not yet. They have to, but that feedback loop has to happen. And our plan is to make sure that every insight we glean impacts that member's care journey and integration.
Yeah, let's go there. I mean, could you talk a little bit more about the newest version of the platform and how this is going to enable MA and CAID and D-SNP plans to sort of change the game?
Yeah. So this journey, I'm going to wind you back a tiny bit if you don't mind. But this journey started in 2004 with certifying. Around, I kind of explained what we're doing interop, and it became really clear to me that the amount of data we're collecting could make a real difference to that patient. With Transit Insights inside of Kibana, we built population health, cloud first platform, highly integrated. It was on Amazon's stack back then. Learned an awful lot. And in fact, we talked about a little bit the other day that I've got a team of engineers that came with me, that have been with me, since 2014-ish, that went with me certified through Transcended. I brought to Icario to reimagine, Icario's member engagement. And, I've known Icario for quite some time. So we basically took a brand new approach to it. Everything I've just told you about how to manage data, integrate data, digest data, make it what I call shoppable. We built our product's called iVela now. It's actually out live. But that platform is highly organized in how it uses the data, how it thinks about it. It's got machine learning that's built into it, it's very young machine learning at the moment, so we can be very dynamic on how we do that outreach. And we tend to want to try and be digital first, right? And with our plans, what we're doing is we're offering a way to, if you break Icario out into, its core elements, it's a machine that automates member outreach using smart inputs. But on top of it, it's just got these, pretty standard channels. Telephonic, call center, right? We engage a call center to call you. We have IVR, where an automated voice will call you to get you to answer. We have SMS, email, and then we're starting to move now to embedded mobile. So we decided, rather than compete against, a big plan's call center, why not put APIs on that layer and allow our engine, which is now steeped in great data and analytics, to actually trigger their own call center to outreach the area rather than my call center. Even though my call center called as Plan A, let's try and use the existing infrastructure in the plan to do it and make it easier for the plan to embrace Icario, right? Because there's a call center somewhere in that plan that might see us as a competitor, right? And it shouldn't. And it's the same with mobile apps. Why would we develop our mobile app if Plan B has got its own mobile app? Let's just use an API to embed in it. So we can nudge and that stuff. So we've really rethought how we think about member engagement, and we've also created very sophisticated reporting and insights around not only just closing that gap in care or completing that HRA, but also compliance. There are rules, for example, around D-SNP, where to be compliant, we have to have reached out to that member in channel A, B, and C 3 times within X amount of time. And if we do it on the 4th time, out of that time, we're not compliant, it doesn't count. And then there are other massive regulations around TCPA, Telecoms Consumer Protection Act, around spamming. So we ingest the data now from the government around TCPA and build compliance reports for our platform, whether it's we monitor every outreach across every plan, or we can give that report to plan C and say, look at your compliance, around texting. And by the way, if you feed us to your other outreach platforms, we'll run compliance around that as well. So, it's starting to, we've definitely transformed ourselves to become what I call headless and more of a member engagement AI machine learning insights company rather than a company that did the call center or did the mail outreach. I sort of ramble on. I just want to make sure. I'll take a breather and sip
Yeah, I want to
coffee.
summarize some of that. This is certainly interesting. So, first of all, obviously the current platform is sort of a accumulation of all the different technology that the Icario company has worked on
Mhm.
and all of your experience, these certifying transcend insights, and it's all coming sort of to a head here. And it involves machine learning. It involves enabling health plans to take action. So the example you gave, or the example I wrote down when you were talking just now, is you could help call centers of a health plan using their existing infrastructure trigger a client or a member call using a preferred what's the word I'm looking for? Just a preferred communication channel. So IVR, SMS, email. You mentioned embedded mobile as well. So far, so good.
Yeah. So when our machine runs,
Yeah.
it will say, okay, Eric needs to get a phone call, Mark needs to get a text, and person
Right.
C let's interact with the mobile app. So with our regional plans, we're going to do all of it. We're going to offer those services because they just don't have the resources to build the app to do SMS. I mean, it sounds easy, but it's very complicated when you put all the regulations around it. But some of the really large national plans, my previous employer, for example, totally has the capability, if I trigger it, to make the phone call to complete the HRA and let us know it's done. Right. So it's about not competing with the plan. It goes back to your thing, how do you integrate with them? It's about finding ways to integrate with them very cleanly as opposed to replace them. If they have a contract with a call center, they've got a great tick pricing on it. Why am I going to bring my call center? And then suddenly you get member abrasion because this call center is doing what this call center doesn't know. What we also want the plans to do is all of their member outreach, just run it through our sequencing engine. I'm simplifying what we do now, Eric. So we can reduce member abrasion because, some plans have us doing gap in care and somebody else doing surveying. Feed it to us and let us do all of it to cut down member abrasion, Eric. Because if I have you on the phone, I'll speak, and you're completing an HRA, and I know from my analytics that you need to go get an annual wellness visit, why not just try and help you get that done at the same time? And that reduces member abrasion. I bet you've called a plan where you've given your name, date of birth, social, card ID number 5 different times on the same call to 5 different departments. That's what this solves.
And you also mentioned you have a component, almost a I don't. You almost help maintain compliance as well.
Very much so. Very much so. Yeah.
And that goes both for the regional plans and the nationals, where you're able to identify potential trends where you may be kind of pushing the envelope so the plan could make sure that
Yep.
they don't get themselves in trouble.
Yep. And there's self-service reports and intelligence. We just showed a demo to one of our customers last night. And because it's super important that they understand how they're doing the outreach and when and where and what the outcome is.
So let's, as we kind of come to a close here, like how are I see the problems that you're trying to solve here. How do health plans realize the benefit? Is it through caps and stars? Is it through somehow correlating what you're doing to reducing total cost of care? Take me through sort of the impact model.
Yeah, I mean, you just hit the first one, the improving caps and stars. That one allows us to go up the elevator with the customer and talk to them. They'll listen to us, right? But the ultimate goal is to improve the quality of life of the member and reduce the cost of care. And the last two, Eric, will only happen if we can integrate and not be transactional. Our data that helped you close the gap in care which then enabled the plan to increase its stars, is transactional, one and done. What needs to happen is all the information that Icario's learned about you, is embedded into the plan's workflows. And that's where you need very sophisticated APIs and bidirectional sharing. I would say right now, and Icario included, the companies that do this are transactional. And I'm moving them to be what I call long tail member engagement, where we're constantly in contact with you. We make sure your information is shared. We'll make sure there's a care plan on the other side. And that allows me to talk to the chief medical officer of the plan, all right, and the leader in stars. So it's really important. It's really important we do that.
How before we close out, because you just stoked some it would be interesting if we could so help me and my audience understand. So in that sort of framework that you just laid out there, what would an example in the day in the life be? So for instance, and I'll try to set the stage for you here, Mark. And let's pretend I'm at a health plan. We're using Icario, and we're working on a specific HEDIS element, or even some sort of specific HEDIS element, and we're going to do some outreach. And we also want to make sure that we're providing a great experience for our members, because sure enough, we're around the corner. Surveys are going to go out, and CAP scores are going to. We're going to have to. Yeah. What's happening if I'm in charge of consumer marketing, consumer experience? Am I using the platform? I'm in a regional plan, or am I calling, or am I bringing in someone from Icario who's actually executing this? Like, I want to make sure people could really understand what it would be like working with you guys.
For sure. It's you can either fully delegate everything to us, and that literally is securely transmit your member attribution file, and we'll take care of everything. Now, let's get to the point where, Eric, you're running, your plan, and you've contracted with us. There's a 3-month journey before we go live, where we're going to really understand what your goals are, the age contracts you have, how you're trying to move the needle, what we need to do to move the needle, who the individuals are, the members in those age contracts, what their personality profiles are, social terms of health, all that kind of stuff, right? Do you have good data quality? Are there any things missing? If you give us just 2 channels to operate on, it's going to limit our ability to reach out to that member. Then with our outreach, it's branded as your plan. The member has no idea it's Icario. We're brandless to the member. They hear it as plan A. It looks like plan A. It is plan A. So there's a 3-month statement of work that we'll walk through with the plan before we get live. And then after that, once we have the member files, the system starts doing outreach on behalf of the plan. And we give real-time reports daily to the plan to the specific member, who we've outreached, how many times, have they responded, have they completed, do they need another nudge? Or you can build it up by age contract. So it's basically, they get a lot of data and insights. Did that answer that for you?
Yeah, I like it. I got it. Makes sense. Is there any way that you're helping the plans circle back and correlate those engagement points beyond the CAP scores and HEDIS scores to see sort of the impact or the results, or some leading indicators that may lead to better impact scores, better CAP scores, excuse me?
Yeah. Some plans ingest our care pathways and take action on them. I mean, you could imagine we will be talking to somebody or picking up a signal on a survey. If we're closing a gap in care, sometimes we're doing it live, and sometimes it's through our digital experience. But if we pick up a signal, we have a responsibility right there and then to shortcut everything and reach the plan and let them know, Mark's got a behavioral health issue that I'm worried about. As we certainly around the HRAs, you learn an awful lot about the current status of that member right there and then. So we build a care pathway, a care plan, and that gets given. Some of the plans ingest it and build their workflow. Some use the HRA as a check the box, Eric, which is not good. But I think that's why the new sort of advance noted by the CMS is saying, hey, no check the box. You're asking a member to do a 10 to a 40-page questionnaire. There's real data in there. Ingest it, use it, build a care path with that member and close the loop. That's Ivela. That's why we went down this journey. So I'd say we're kind of all over the place. I would say in general, the plans take what we do for them and what they do with us very seriously. And I think technology is going to help integrate that data straight through to the member over the next couple of years, a lot easier, a lot quicker. I'd like to see us full digital. I'd like to see us embedded in an app. I'd like to be able to nudge you right now, say, hey, you need to go get your annual wellness visit. And here's an incentive, because we'll do incentives and rewards. Here's an incentive to go do that. And by the way, Eric, now I've got you engaged. Go grab a cup of coffee and let's complete this health risk assessment. That, and it needs to be all driven by AI. We do not need human beings making the phone calls. We can use AI and chatbots. We can have a chatbot help you complete an HRA. The CMS won't do that right now because they want scripted questions, which is another challenge, right? But we can make it a lot more interactive with AI-driven chatbot to actually engage you and get you to complete this survey and know me, right? So I think over the next few years, things will change a lot. And I'm excited to be there. I'll just say it right now. It's been such a long journey for me. I really enjoy it. This is probably the last platform for me. I really, really want to see this transform member and patient engagement and really push that know me concept out there. So you don't feel like you're calling some sort of black hole when you talk to the plan. They know you the minute you pick up the phone. They understand your medication, when your last visit was, everything about you. That's the foundation that we've built and we've been building for a number of years. And I guess lastly, I'll give a lot of credit to Bruce Ardo at Humana and Brian Leclerc, CIO, is they really empowered me to go after this. And I left Humana super good friends, but really needing to go back to a faster pace of life and innovate a lot quicker. And this is what the board of Icario and the teammates at Icario have enabled me to do. So it's a great journey we're on. I'm really excited about this year.
Beautiful. So you could learn more at icariohealth.com. That's ICARIO health, one word.com. I want to thank everyone for tuning in today. We do not take the time you spend with us for granted, and we hope you use the bright spots shared during this conversation to inspire your thinking and enhance your company's overall approach to improving healthcare for all of us. Thank you to Marc Willard and his team for helping us prep for all this. We produce the show for all of you. Remember, this is your Bright Spots in Healthcare podcast. Take care, everyone.